is innovation. And it's not only about technology, so we don't want to invent new technologies, replace human beings. And I say that because I have received these type of questions in the past. So innovation for us, and this was also a big topic, it's not only innovation in digital technologies, but it is a very important component, but it's also about systems. So innovation in health and social care, maybe finding new and better ways to organize these systems. And it's also about organization, so perhaps finding a new organizational method in the workplace. And it's about delivery models, so finding new approaches to health problems, and social innovation is also key. So having said that, that's pretty much, let's say, the background to this partnership. We had the public consultation 2 years ago. We created a high-level steering group composed of high-level CEOs, ministers, so we had a lot of member state support, healthcare professionals, doctors, hospital directors, patient organizations. So this was the steering group, let's say. The European Commission, we are the facilitator, or the secretariat, as we call ourselves. And with the stakeholders, we came up with a strategic implementation plan. So don't get scared by this temple. It's just to show that this partnership does have a structure and it does have a framework, which was endorsed by the Council, by member states. And what I want you to take from this slide is that we have 3 pillars in this partnership. So we have a pillar that's dealing with prevention, screening, and early diagnosis. Another pillar is care and cure. And the last pillar is active aging and independent living. So really, there was lots of brainstorming and debate, but the conclusion was we need a life cycle approach. We cannot just focus on people when they're sick. We need to focus on them before and in older life. So this is the kind of, let's say, our temple. And within that temple, there will be lots of activities, but 6 specific activities, those bubbles, have already been determined. And why? Well, consensus was reached on these 6 action areas because a lot of work already exists in Europe. So as I said, we don't want to start from zero. We want to build up on what is already existing. So these 6 areas have been chosen as the areas, and there will be more in the future. But these 6 action areas also, we are confident, or the stakeholders are confident, that they can deliver some results by 2013. That's very soon. But so the first action is on improving prescription and adherence to treatment. Then we have another action on better management of health, so specifically prevention of falls, which is also a leading cause of injury for older people. We have preventing functional decline and frailty, so this can include nutritional screening or anything to do with nutrition. And then I'm going around counterclockwise. Then we have an action on ICT solutions that help people stay independent and active, so to live active in whether it's in society or in the home, to avoid hospital admissions. And then we have an action on age-friendly cities and environments. We have strong support also from the WHO on this one. And last but not least, we have an action, and this one is actually the most popular, and I'll explain why. It's on integrated care for chronic diseases. So these 6 action areas were defined. We've created action groups composed of stakeholders, and they are developing action plans. So unfortunately, today is a little bit early because on the 6th of November, we have a huge conference in Brussels where we will be presenting these action plans for the first time. So you see these action areas, but there will be more specific commitments or activities. So very concrete activities with indicators, and then the implementation has to start in 2013. Everybody can engage, yes, but we did have, let's say, an open call to attract stakeholders to commit to these 6 action areas. So we did have an open call, which ended May 31st. Doesn't mean you cannot get involved, and I can discuss that with you bilaterally in more detail on how you can still join the process. The point is that these action plans they're being developed as we speak by the 6 action groups. So we don't want to disrupt the process, but there will be opportunities to get involved at a later stage. Then I must mention this concept of reference sites. We've also had a call. Reference sites are, we wanted to have an idea of regions in Europe or geographical areas where actions are already concretely taking place. So people who don't have barriers, who are doing fine without the EU, but they can share their lessons learned, because we're not sharing. There's lots of information out there, but we're not sharing. So this idea of reference sites is very different from the 6 action areas. The process will be different. They already exist. Things are going on. But in a way, we want to put a gold star on what is already existing and promote or encourage these reference sites to share what they're doing. And then we also have actually a website on the partnership, which is called the Marketplace. This we've developed more for, let's say, stakeholders who are just not ready yet to commit, or they don't know exactly how to commit or how to get involved. So we have, it's an interactive online platform where you just register. It's not very complicated. You can meet partners, you can chat, you can exchange best practices, information. You can upload initiatives, so you can share your initiatives. So please, I have the website on my last slide. So please join the Marketplace. And then just to show you, from this open call we had for commitments, we received 261 proposals or commitments. And they're divided according to the 6 action areas. So you see that integrated care, we received 67 out of the 261. So this was the most popular one, where stakeholders are telling us, okay, we want to work in this area. But they're all equally important. It's just the way it is. And then maybe to give you a concrete example, maybe I won't go through of these 3. I don't know how much time I have left. 1 minute? Okay, I will give just one example. First one, Galicia. So Galicia in Spain sent us a commitment where they have a program of ICT tools for the prevention of falls. The idea is a tool to assist patients to exercise and to help healthcare professionals evaluate the quality of their prescriptions. So these are the type of commitments we've been receiving. All of the 261 commitments will be uploaded or are uploaded to our website already. So you can take your time reading them. This is a map showing you where the commitments came from. So mainly the blue, whatever shade of blue you see, that's just a representation of who is working on what. And unfortunately, it's true, Central Eastern Europe is underrepresented. We did receive 1 commitment from my country, the Czech Republic, so I'm very happy, but we need more. We need to do more. So that's the map. That's the Marketplace, and the website will be the last slide. We've had over 8,000 visits since it's been developed in May of this year. 200 users. And there's events, we post initiatives, we post daily news. Last but not least, I must mention funding, because everybody asks, okay, this partnership, is it a new funding instrument? What is it? No, it's not a new funding instrument. And on this slide, you see all the different funding instruments that already exist in the European Union, in the Commission, that deal with aging. So what we want to do is build synergies. We want to use what's already existing. So no, the partnership is not a new funding financial instrument. And my last slide, the milestones. We started, we're in the middle, let's say, of this process. We have this big conference on the 6th of November. If some of you are interested to come, it's by invitation only, so please come to speak to me. And I guess the main thing is that we will unveil these 6 action plans, which are very concrete. Because now we've had 2 years of brainstorming, so now it's really time to implement, to be successful. And thank you very much. The first is the link to the website and my email address. Thank you very much. I hope it wasn't too boring. Of course.
Vratite zadnji slajd da mogu ljudi napisati.
For the link. Thank you.
Hvala lijepo. Thank you very much. Samo da si možete zapisati, Mirando, samo smo. I sada imamo zadnju prezentaciju, zadnjeg govornika, ministra profesora Mrsića, i onda ćemo nakon toga imati raspravu odmah čim profesor završi. Možete sad maknuti. Izvolite, ministre.
Hvala lijepo. Prije nego počnem, ja bih malo parafrazirao svog kolegu ministra Ostojića. Kaže, ako je novac problem, onda nema problema, ali ako imate novca. Tako da će nam se to provlačiti kroz cijelu sljedeću godinu. Dakle, moj zadatak je danas da vam približim dio onoga što se događa na tržištu rada, što se događa u sustavu mirovinskog osiguranja i da probam približiti sve one probleme koje imamo u ovom trenutku u Hrvatskoj i što će se događati u Hrvatskoj do 2025. do 2050. Neki od nas neće biti tu, ali neki će možda pamtiti da smo raspravljali o tome što će u Hrvatskoj biti do tada. Mi u Hrvatskoj u ovom trenutku imamo negdje otprilike oko 3,5 milijuna ljudi koji su u tom takozvanom radnom dijelu. Prema predviđanjima demografa, tu je i profesor Čipin koji nam predviđa vrlo crnu budućnost 2050. To znači da od 3,5 milijuna ljudi koji bi mogli raditi ćemo se spustiti negdje na ispod 2 milijuna. Što govori u Hrvatskoj da ćemo mi biti zemlja koja će imati vrlo malo radne snage, a da će imati vrlo velika opterećenja na zdravstveni i mirovinski sustav. U ovom trenutku u Hrvatskoj radi 1.300.000 ljudi. Naša pokretljivost radne snage je izuzetno niska. Možemo i mi sami sebe pitati, dobro, mi koji smo iz Dalmacije došli u Zagreb pa smo se tamo oženili i ostali, ali se nismo micali iz Zagreba više, a da ne govorimo o tome da se nismo micali ni iz jedne tvrtke. Primjer je evo i mog oca koji je 40 godina radio u jednoj tvrtci i to završio svoj radni vijek. Dakle, pokretljivost radne snage u Hrvatskoj je izuzetno mala. Naša negdje otprilike svega 57% raspoložive radne snage je zaposleno, dakle mi bi trebali doći na onaj standard Europe na 75%. Dakle, sve to govori da u Hrvatskoj godinama nismo ništa radili na tom polju i da smo dugo godina gurali glavu u pijesak i razmišljali o tome neka bude sada ovako, pa nekako ćemo se snaći, zadužit ćemo se, a neko će iza nas probati vratiti ono što se zadužimo. Ono što definitivno tvrdimo i što je bazirano i na istraživanjima, Hrvatska ako hoće ići naprijed mora imati 2 milijuna zaposlenih. Što znači da osim što pokrenemo privredu, to će se pokrenut će se investicije i Europa će se izvlačiti iz recesije i Hrvatska će se izvlačiti iz recesije. Međutim, da i zaposlimo svih onih 350 tisuća nezaposlenih, još će nam faliti barem još 300 tisuća ljudi koji će naći svoje radno mjesto u Hrvatskoj. S druge strane, mi u ovom trenutku u Hrvatskoj nemamo strategiju u kojem smislu Hrvatsku treba razvijati.